I do want to introduce our great patient navigation coordinator, Becca Baldridge. She's fantastic. She's been with us about the same amount of time as I've been with Ulman,
Mhm.
but she's very graciously donated her time tonight to introduce a little bit more about what she does, but also to introduce the topic of cancer and why we are all here.
That was a great introduction. Thanks, Andrew. Well, so nice to meet you all virtually. I'm super excited to be here tonight and get to talk with you guys and yeah, hear from you guys as well. Like Andrew shared, I started here about 4 months ago. I work at the Ulman Foundation as a patient navigation coordinator. So my role is kind of split between supporting patients in the community that live in Baltimore or just in the United States and even some international patients who have a cancer diagnosis and are looking for support. So anyone from the ages of 15 to 39, I can support remotely or in person. So helping them find resources to just face any barriers they might be facing during treatment. And then part of my role also is supporting patients that stay at our house. The Ulman House supports and houses patients in active treatment for free. And so I help support patients that are staying at the house while they're going through treatment as well. Prior to my role here at Ulman, I worked at Johns Hopkins. I got to work with Dr. Jimmy, which was the best. But I worked in pediatric oncology as a child life specialist. So I spent a lot of time providing education for patients and families about what it meant to have a cancer diagnosis and help them cope with that too. So as we're going to talk about, there's so many nuances and types of cancer, whatever diagnosis you might have, what your treatment looks like. And with that, there is a lot of need for coping and emotional support. So I spent a lot of time just supporting patients while they were going through treatment. So I will hand it off to Dr. Jimmy to introduce himself and his background, and then we will jump right in.
Well, thank you all so much for having me. My name, yeah, I guess Dr. Jimmy is what in the pediatric world, we go by our first names, but every other physician goes by their last name. But yeah, have worked very closely with Becca, and I appreciate the Ulman Foundation having me on tonight. Y'all do just absolutely incredible work for the patients that we take care of, and then obviously the young adults who come through. But just, I know there's a lot of sort of trainees or high school students either listen to this now or later, and so um, just wanted to kind of give a background for anybody possibly interested in medicine. It's an awesome field. It is, in my opinion, the best job in the world, despite what various different maybe relatives or friends or anybody will say. It is definitely a lot of work, but it's awesome and super rewarding. So what it's looked like is high school and then 4 years of undergraduate work and then med school to some degree, which is 4 years, and then training in something called a residency, which is a very much your working hands-on, learning all of the stuff you learn in medical school and putting it into practice. And then you specialize into something after sort of general. So I initially did a residency in pediatrics, and then I'm working through a fellowship in hematology oncology currently. And so it's really, is that high school, college, medical school, residency, and now fellowship training. So it ends up being 12 to 15 years of your life, which is amazing, but it's also a lot of time. So it's important to be considering those things. But if anyone's interested in in thinking about a medical career or anything, or has any questions, please reach out to the great crew at the Ulman Foundation, and I'm happy to chat with anybody. But excited tonight to at least dive into a little bit of sort of what is cancer and kind of destigmatizing some of the things around it.
I love
Great.
it. Thanks for starting us. If you want to ask the first one, then we'll jump into one of our videos to kind of explain cancer, and then we'll dive in after that.
Love it. And as I think Andrew was saying, this is very interactive. So I'm happy, being some of the sort of stereotypes are right. Physicians can talk, and so I'm happy to chat. But also we love participation. So the first question, we kind of wanted to open it up to everybody again in the chat, or feel free to unmute yourself, is what comes to mind when you hear the word cancer?
Any thoughts? It can be anything small or big that comes to mind.
I know with the diagnosis, there could be like a lot of fear or anxiety that comes with that.
Yeah, totally.
Mm-hmm.
Hmm.
A life-threatening disease or tumor as well. Yeah, I think both of those are great. I'll share one brief story before we get into the video. Um, you mentioned the word fear or anxiety, and I think that hits it on the head. I think part of the discussion tonight is like, what is cancer from a medical standpoint, right? What is that? What is a tumor? What is a cell? All of those sort of things that are really important. But I think a lot of what Becca and I do as well is, what does cancer mean to a human being or a family? And I think you hit it on the head, fear. I have taken care of patients in Baltimore and in Tennessee, young and old, and you tell them, you break the news that they have cancer, and that is the first thing that goes to anybody's mind. And it's just it's a gut human emotion. Um, in English, when you hear it, you can just see on their faces, there's this kind of like, you stop breathing for a second. There's a, and I remember in medical training, I actually spent a summer in Tanzania and didn't know the language. We were using interpreters, and the exact same thing happened. You don't need to know any language to see the look or the fear on somebody's face when they have that diagnosis. And so it's cross ethnicities, it's cross backgrounds, it's cross languages. Fear and anxiety is by far one of the most important things that we think about when the patient has that. So you hit it spot on.
What is cancer? The chances are high that you already know or will know someone with cancer. But how does cancer form and where does it come from? It all starts with our cells. Our bodies are essentially cell factories. The cells in our body normally grow and multiply to form new cells as our body needs them. Cells can also become damaged and die, and our body replaces those with new cells through a process called cell division. Sometimes this process breaks down though, and dividing cells acquire DNA variants that may cause them to grow abnormally. This growth can lead to cancer. Cancer is a disease that results when some cells in our body lose important functions. This causes those cells to grow out of control and often cluster in cell masses, sometimes called tumors. Damaging DNA variants can cause cancerous tumors to grow in nearly any part of the body. For example, lung cells that have DNA variants may develop lung tumors, potentially leading to lung cancer. This pattern holds true for practically every cell in the human body. While some of these changes can be inherited, the vast majority occur spontaneously and are not passed down from generation to generation. Cancers are dangerous because of the way that tumors grow and spread. Since cells grow and replicate faster within tumors, the chance that damaged cells will accumulate more DNA variants increases. This in turn can grow the size and speed of a tumor's development. These features of cancer make it difficult to study, as cancer is not just one disease, but many collections of DNA variants varying from person to person and organ to organ. Despite these challenges, the research community remains strong, creative, and dedicated to finding treatments, and more people are surviving cancer than ever before.
I think that's a great background. When we think about sort of big picture ideas of what cancer is, and in medicine, when we think about diseases, we think about things that kind of arise from outside of humans or outside of the human body or human cells, and those that arise and come up from things inside the human cells. And so cancer definitely is a disease that arises a majority of times from inside human cells. And so this kind of graph or schematic here shows the differences between normal cells versus cancerous cells. Before we even think about that, I just want to take a second to kind of, I think, blow everybody's minds for a second. The human body has trillions of cells in it right now. If you're sitting, most of y'all are in high school, you're young adults, 36 trillion cells. That's a lot of cells. And each one of our cells has billions of little, like DNA is made up of billions of little sort of nucleotides in it. So there's 7 billion nucleotides in each one of our cells, and there are 36 trillion cells. So if you take a step back and think, cancer, is it just an error in one of those cells, in one of those DNA bits, in one of those cells that has gone wrong? And so the fact that every single person at all times doesn't have cancer is kind of mind-boggling, that we have these mechanisms in place to not do that. But when something does go wrong, that's kind of what you see on the graph here. So up top on the far left first, you'll see that normal cells are sort of the basic unit of life. And a normal cell, if it gets a signal outside of it that says it to stop growing, it'll stop. But cancer cells don't do that. They continue to divide. They continue to grow. And they also, if, like, let's say we're a heart cell, or let's say we're a lung cell, all of those cells will basically be the same size. They're just kind of structured in a specific way. But when you have a mutation in your DNA that leads you to sort of be an abnormal cell, those cells can kind of be bigger or different sizes that can also cause problems. And what this does is these mutations, so I guess to take a step back, inside each cell, there's something called a nucleus, which you kind of can see that darker circle in the middle. And inside that nucleus, all of your sort of what's called DNA, which is the sort of human code, or sort of the words on a page that make a story. All of that DNA is hidden inside that nucleus. And so if you think about it, a normal cell is a nice small nucleus because it doesn't need to constantly be replicating its DNA. But cancer cells, wanting to divide more and more and more, will have these really big, large nuclei that's open to sort of DNA kind of and cell replication. When you develop a lot of mutations inside your nucleus or inside your the cell, that can lead to something called sort of abnormal numbers of chromosomes, which again is a hallmark, one of the hallmarks of certain cancers. And the last thing that you see here is these cells kind of just can grow and form these masses that they don't respect boundaries. So you'll hear about different stages of cancer, different gradings of cancer. And so sometimes cancer cells can kind of just divide and grow into spaces they're not supposed to go to. So big picture stuff, normal cells have all of these stop mechanisms inside of them to just kind of say, hey, this is what I'm supposed to do. I'm not going to do anything more. Cancer cells have kind of lost all checks and balances and are just kind of going haywire. I think it's important as we think about this, particularly from an educational standpoint, to think about what cancer is and what it isn't. We were talking before everybody got on that there's going to be some stigma around the word cancer. But the video did a really good job of saying, most people are sort of 1 or 2 degrees of separation. So like, if you are a high school student, it's either maybe somebody who's had cancer, or a family member who's had cancer, or if you talk to your parent, they know somebody who's had it. And so it really is a disease that affects people throughout their entire lifetime, but also like loved ones, basically at all times. And it's very common disease, and it's one of the most common diseases as adults get older and older. So what it is it's definitely a disease in which some abnormal cell is starting to grow uncontrollably. And it's something that doesn't have to, but can spread. That's called to other parts of the body. That's called metastases. And it is it's a majority of the time caused by either changes in your DNA or something called epigenetic factors, but like things that alter how your DNA works. And then classic naming or nomenclature for it is based on where the cell of origin is. So for example, like if you have your heart cell as a problem, then that would be like a cardiac tumor. And if you have a lung cell, the abnormal cell is a lung, then it's lung cancer or breast cancer. What it's not, I think this is really important, is it's not contagious. Unlike either COVID or unlike some sort of respiratory diseases that you can get viral infections, which can be spread from person to person, cancer is not contagious. And it's not the same as sort of either getting injured or infected, right? It's not from outside germs. There's basically 1 or 2 sort of viruses that can eventually lead to cancer. but other than that, it's mostly from, like I said, inside your cell. And the other thing I think is really, really, really important, which is kind of taken life over the last 15, 20 years, is the word cancer is just this umbrella term. It's not actually a disease, but it's an umbrella term that describes hundreds, if not thousands, of diseases inside of them. And some of cancers have really good prognoses and some don't. And so it's actually multiple diseases under the umbrella of cancer. All right, back to the class participation. What types of cancers have you heard of, or what I guess comes to mind when you think of a specific type of cancer?
See, leukemia, blood cancer, breast cancer, lung cancer. Keep them coming.
All right, Glenn, you're going real specific. Glioblastoma. Yeah. These are all great. Yep, every single one. I mean, again, if you can think of an organ, there's a tumor yep. Pancreatic, kidney, glioblastoma, lung cancer, breast cancer, all many types of blood cancers, leukemias. Yep. I think y'all hit most of them. The most common ones in adults is what Elliot mentioned: breast cancer in females, prostate and lung cancer in males, glioblastoma is a type of brain cancer, pancreatic cancer and kidney cancers. All right. And then in young children, leukemias are by far and away, blood cancers are by far and away the number one type of cancer in younger children, less so in adolescents and young adults, but still pretty common. All right, yeah, let's just go take it right back to y'all. If y'all are so good at knowing the different diagnoses, what do we do? How do we treat cancers?
Yeah, chemo.
Mm-hmm.
What else?
Themselves.
Is that it? I love that. Perfect.
Yes,
Yes.
Grace. Cute. I
Immunotherapy.
Nice, guys.
love it. Yeah, I think all these are great starts. I think it's kind of an interesting. If anyone's ever, I'm sure y'all are super busy in school, but if anyone is ever wants to learn more about this, there's a really cool sort of interesting history of sort of the treatments we used to use, because cancer has been around. I mean, there's like Egyptians sort of a long time ago wrote about certain cancers. In fact, I think like there are fossils from either like dogs or dinosaurs that had Ewing sarcoma. And long story. Anyways, the history of treatment really started. You think about the first person mentioned chemotherapy. So Sophia, you said chemo, which has kind of been the mainstay for the last 50 years of what we've done. But prior to that, the number one way that people would deal with cancer is you would just cut it out. So prior to the initiation of chemotherapy, which is in Sidney Farber in 1950, very, very cool story. If anyone ever wants to read The Emperor of All Maladies, where they talk about this, a doctor just in Boston thought that he would make bad cells good by giving them this thing called folate, which is a vitamin, and it actually made cancer cells grow faster and faster and faster. And so he then said, wait a second, well, if these kids that I just gave this therapy to actually got worse, what if I blocked folate? And so the first chemotherapy was actually derived because this person initially messed up and then rethought about his hypothesis. And so it came up with a folate antagonist, which is known as methotrexate. So in 1950, it was the first one. And we still use methotrexate to this day. And so kind of basically it was surgery. Pre-chemotherapy, there's this other thing that happened as a result of people figuring out how to use protons to do other things. But really, they figured out that you could also radiate cancer cells. And so that was the second main pillar. And then for the last 50 years, the third main pillar has really been chemotherapy. And not just chemotherapy or one of them, but multiple. The biggest some of the biggest gains have been instead of just using one, you use 1, 2, 3, 4, 5 different chemotherapies to try to trap cancer cells. You'll see on the next slide that we've started to move towards some other things, but there's more targeted therapies now. So you've seen chemo, you've seen surgery, you've seen radiation. On the right, we've started using different forms of radiation, proton treatment. Ben mentioned stem cells or bone marrow transplants, where you can basically try to get rid of your immune system and give you somebody else's to fight it off. Grace mentioned immunotherapy, which in the last 10, 15 years has essentially exploded and really become what is now the fourth pillar of cancer treatment. And sorry if you can hear my daughter in the background, she's crying because she's going to bed. But immunotherapy, this is just another aside, is kind of exploding into what its ability to do. And one immunotherapy medication called Keytruda is actually the #1 drug in the world right now. It is so effective in some of the things it treats that it has overtaken every other medication in how many people are getting it. So it's a pretty cool time to be in this field. And one of the parts of being in this field, though, is being on clinical trials. So if there are things that historically have not worked well, patients can enroll in clinical trials as options to try to see other newer therapies that might work. And then we always are thinking about how can we use complementary medicine approaches and work with sort of other providers to help with that as well.
That was a great description of types of cancer treatment, and just going into detail of what all that looks like and what that means. We want to jump a little bit into types of support too. So as we've talked about, a cancer diagnosis is and can be really scary, especially in the beginning when you're hearing, this big word and you don't understand fully what it means yet and what your treatment entails. So part of my role and other staff's role at the Ulman Foundation is providing support to these patients. So we work in different hospital systems. I work as a remote navigator, as I shared, so helping meet people that are not in these hospital systems in the Baltimore area. But we also have navigators at Anne Arundel Medical Center, Walter Reed, University of Maryland, and Hopkins, as we've talked about. And so a lot of our job is just meeting people where they're at, especially young adults, because this time with the cancer diagnosis is often the most hard as you're navigating maybe high school or entering college or in your first kind of job. So whatever you might be doing in your life, putting on top of a cancer diagnosis is really challenging. So our whole job is to meet you where you're at, to provide support, help address barriers, and just help with coping. So yeah, as we've kind of talked about, cancer is not an easy thing to go through, and it can feel scary and frightening, but a big part of the Ulman's role and job is to help support patients while they're going through this so that they're not alone and they have the support that they need. Our next clip is a video just to kind of showcase some patients' stories. I think that it's really meaningful and helpful to hear from patients who have gone through cancer treatment and caregivers as well to see how they've been impacted. So we'll hear a few clips of some patients that have gone through treatment.
Before I was diagnosed with cancer, I was preparing for my senior year of high school, preparing for the SATs and preparing for college.
We had to learn on the fly what all these different things meant. We have to learn on the fly or figure it out or Google it or look it up or ask a lot of questions.
What do you do after you are diagnosed, after you go through treatment? Where do you go to find somebody who knows how to help you?
There weren't any gradual steps to be taken. We were just immediately put into the situation.
As I was going further and further through the process, I started to realize I wouldn't be able to work. Started to realize that there was going to be some financial concerns. Like one of the therapies that was offered to me, it was anywhere between $500,000 to $1 million was the cost of it.
All along his initial process, he kept saying, "Mom, it's going to be okay." I guess because he could see, he could see my face.
The work of the Ulman Foundation is so tangible because every young adult we serve has a unique story. Whether they're staying at the house, whether they've interacted with a navigator, whether they've experienced another one of our programs or services. And if we can be a part of that story and help inspire a better outcome for their journey, that's what we aim to do.
Because not every patient experiences the same needs at the same point in their cancer journey or to the same level, we offer support services and a whole array of things that patients can tap into when it's right for them.
In spite of ugly situations, there are beautiful people, whether it was the patient navigators who were just asking me, like, how's your day going? Do you want to have kids someday? Helping me with nutrition. Having the Ulman Foundation helped me realize I wasn't alone in this world.
In a healthcare system that feels very impersonal, we are there to make this feel like a very personal process, and that it's not just them as a cancer diagnosis, but they are as a person.
It's just those little touches that to me say, I notice you and we're here for you. And even if no one says it, it's communicated.
If there's anything that's needed, they'll provide it. I was diagnosed with osteosarcoma, a tumor in the right leg, so it was hard to transport me from one place to another. And the Ulman House provided an elevator.
So Cancer to 5K, it's been so nice to have people to meet with and talk to twice a week for the last 10 weeks or so. It does create pretty strong emotional bonds when you do get to meet other people going through the same things as you, and I've been blessed or lucky to be able to meet people in person, meet people online, other survivors, and we just bond so quickly and then have those relationships that are deep and just life-giving.
The journey that I had 25 years ago is different than someone who's diagnosed today or tomorrow or next week. And this organization has been able to adapt and evolve and continue to serve and stay relevant with the population that we aim to provide for. And that is easier said than done, and it's been awesome to witness.
We pride ourselves on being courageous and being a thought leader, listening to the needs of our patients and families, delivering services and programs that are meeting those needs.
The fact that I'm here and I'm alive because of people's love makes me feel like invincible almost. And I hope that this kind of love is infectious. I hope it infects other people, because it's definitely transformed how I view love. It's definitely transformed how I view people and human experience.
Like that video gives a really holistic picture of what it looks like to go through treatment. We just talked about how hard and scary it can be, but also the perspective that it gives you too, as well as the support that our foundation and other kinds of nonprofits and hospitals provide too. We offer a lot of programs here at the Ulman Foundation, which kind of was highlighted in the video, but we have Cancer to 5K, where caregivers, survivors, patients can go for walks, runs together, and it meets weekly for 12 weeks, and then it builds up to do a run. We have programming throughout the week. We have all these kinds of different things that we do to meet up so that patients aren't alone and have support throughout treatment and after treatment as well. So yeah, I love that video. I feel like it just kind of highlights what we're doing here with our foundation and also just showcasing patient stories too. But now we can jump into some questions and answers time. So if anyone has any questions for me, for Andrew, and for Dr. Jimmy, feel free to ask them. You can do it on chat or unmute yourself too, whatever works. And no question is too small.
Yeah, and while we wait, one more thing I like to point out about that video, which I think is also really fantastic to notice. You all notice that every single person in that video was not alike. So it kind of really reiterates the fact that cancer does not specifically target a certain group. It is out there with no matter who you are, your background, where you come from, you have that potential of being diagnosed with cancer. So it really does affect everyone, which is, I think, a very powerful idea to think about. One question I did have for Dr. Jimmy while you guys come up with some of yours. So over the last few years, I'm sure a lot of people have seen through the news about there's certain things that cause cancer. So are there certain targeted things? I know in the past I've seen cell phones cause cancer. I've seen, I think 10 years ago, I think they said chocolate caused cancer. It feels like there's all these things that are thrown out there that could potentially cause cancer. Are there any specific things that high schoolers should be looking at or avoiding to help kind of separate themselves from that cancer diagnosis?
That is a great question. I think you touch on something too, though, that is where do you get your information for these things, right? I think sometimes these it can get a little whether a social media is a good or a bad thing, it kind of drive like, oh yeah, chocolate causes cancer, and then the next week it's like, wait, nope, it actually doesn't. So I think what you're hitting on is a reliability of information and where you go and get it. So if somebody first of all is thinking, how can we what should I avoid, or what risks or things should I avoid for cancer? I think it's important to be, whatever information you're getting that from is a reliable source. So the American Society for Clinical Oncology, ASCO, is really good. There are other like very reputable sources that can kind of guide that. I think for high school students, honestly, there's not as much. Hopefully, there's not as much many things, but we know that as you transition from sort of pediatric cancers, which are mostly genetics based, things that you either have this sort of point mutation inside your cell, as you transition from that more to adult forms of cancers, a lot more adult cancers do have what are called these sort of environmental hits. So it's why there's been such important education going on around tobacco smoking. So tobacco led to a lot of lung cancer. And there's this very beautiful graph that as we started realizing these things and taking steps, legal steps to limit who can get cigarettes and make it harder to do them and tax them, there's a sharp decline about 15, 20 years later with the amount of lung cancer. Excessive amounts of alcohol can do that. There's not really, though, to your point, chocolate, not really bad, eat as much as you want. But exercise, we have found actually that exercise and sort of staying or doing your best to live a healthy lifestyle can actually decrease your likelihood of getting cancers later in life. But again, it's not, hopefully not really as much in the population we're seeing in our high school and adolescent young adults. Phenomenal question. Phenomenal. Grace, I recognize that this field, this sort of work may have emotional tolls. How do you overcome them and maintain positivity? Who wants to start with that one?
I think Becca should take that one.
That is a great question.
Becca's like the most positive person I know. So yeah, you should take that one.
That's very kind. Yeah, that's a good question. It can be a hard field of work to work in. As you said, there are emotional tolls, and when you work in this field, you get to know patients and families very well. And so you do form really awesome relationships with them, and that can make that awesome and also really hard. I think for me, it's been helpful to find things that I find joy in and kind of like self-care strategies. So I learned that pretty quickly, post-college, of what was helpful to kind of build me up and help me after work. So for me, it was like being outside, like taking walks after work. I like to journal. I like to my faith is helpful for me. So spending time in my community, different kind of avenues like that. So just finding space and time that kind of like pours back into me and that I can separate my day at work from my day at home. But there's definitely times where that's really hard, and it's helpful to have people and spaces to process that with too. So I'm not always positive, but it helps for sure. Any other thoughts from you two?
Yeah, I mean, I think you're spot on, Becca. I think it's a tough field, and I think there are good. All human beings have good coping strategies and bad coping strategies, and so I think whether this is an emotional field or just in general life advice, there's a lot of other emotional fields out there too. And I think you have to ask the question of, what do you run to when things get tough? I think Becca hit a lot of the important ones: community, faith. Those can be very important. Outdoors, kind of de-stressing and not just carrying work with you a lot is important. I think the other thing to maintain positivity or good outlook on these things, twofold. One, in the pediatric and adolescent and young adult space, survival rates actually, compared to sort of later older cancers, are pretty good. And so you have really sad stories, but you also can, like some of those participants said in these videos, you can walk people through their darkest days. And I think there is strength, and there's beauty in trying to do that. And so that also helps maintain some of that positivity as you're going through it.
Exactly. Yeah. Everything that they said, 100%. One thing I do want to add on, something that Ulman House does a fantastic job of, to really make sure that we are focusing on the positive side of what's going on. Yes, there's a lot of negativity that does come around the journey of the cancer diagnosis, but there's so many small victories that happen across the way. So finding for us, I mean, this is how I get through. I know those of you who have worked with me before know Ilani Myers. She's definitely my go-to if I need inspiration. That's who I turn to. But finding the bright spots of what's going on, whether it's at Ulman, we have which one first and foremost. I invite all of you to come visit Ulman House. I would love to get as many of you there to come see what we're doing so you can kind of understand a little bit more of what we're talking about. But we celebrate every small win, whether it is with us, whether it's with the patients. If a patient just finished their first chemo treatment, a lot of people will look at that as great. That's only the first one. There's so many more to go. Why are we not celebrating? You got through that first big step. Whether it's, oh, we get to go home for the weekend for the first time. Yes, we're going to celebrate it. And what's really cool at Ulman House is when these small victories do happen, the entire Ulman family is there. Everyone that works for Ulman is there lining up with you to celebrate it. So a lot of these big wins tend to, we try to make them outweigh the bad. So always focusing on the good whenever possible.
I love that.
Sophia, oh, go ahead, Becca, sorry.
Oh, no, I love that. I think that's great. And to go off of that, we have a bell at the Ulman House. I'm sure you guys have seen videos of cancer patients ringing bells when they're done their treatment. So we do that at the Ulman House, but also we just celebrate other milestones too, like Andrew was sharing. So if you're going home for the first time in a long time, you can ring the bell if you want to, or if it's your birthday and you really want to celebrate, or if you finished your radiation. So exactly that, like celebrating all of the good milestones too, because those are so important and worth to celebrate. So just to add on to that.
Love it. Sophia asked, how relevant is art therapy for patients with cancer? Before we get into that, Sophia, is this something that interests you? Because if so, we have someone to introduce you to. Maybe. Anyway, if this is awesome. Okay, so you wrote an article about art therapy with cancer patients. I would love for you to come to Ulman House at some point and meet Diana Ulman. She is the mom of Doug Ulman, who is our founder. She is very, very big into the art therapy area. All the art that's actually at Ulman House was done by Diana Ulman, and some of it is done through the art therapy classes that she has taught. This is a big area of focus for her, so at some point in time, I think it'd be great. I think we're going to try to get her to speak at some point too, but I think that'd be something great. It's definitely a very optimistic field that really helps kind of channel a lot of the feelings that people are feeling as they're going through the cancer journey, to be able to kind of, since it's very hard to put into words how you're feeling a lot of times, it allows them to kind of escape and be able to release their emotions in a way that it is kind of more appropriate for how they're feeling. So there's a lot of opportunity and a lot of relevancy when it comes to art therapy. Again, another great thing that's really cool with Ulman, I know Becca can talk about this. We don't just focus on the chemotherapy or the basics of medicine. We focus beyond the physical and go to the mental as well. We have holistic healers that will come in and do breathing therapy. We have massage therapists that will come in and do massage therapy. There's so many different things that not only build the body, but also build the mind. And art therapy is a great example of that.
That was so well said. Yeah, I echo that. I think there's so many types of therapies that are so beneficial during treatment, art therapy being a huge one. We do love art therapy at the Ulman House. So yeah, Katie, one of our colleagues, hosts a weekly craft night where people can join on Zoom and they can do their own craft while they're kind of having a support group at the same time. So it does provide so much like community, but also healing through expression in a different way. So yeah, we have a lot of programming for art and other kinds of programming too. And Sophia, I also know some art therapists. So if you want any contacts, I'm happy to like email you or send you their emails too, because they're wonderful humans and happy to connect you guys.
Yeah, Sophia should be answering that question. She's wrote an article on it.
Yeah, you want to share anything else?
Yeah, Sophia, we'll get you that. We'll have to get you to the house sometime.
So important.
Big part of this program again as well is we do want to make sure that we're also introducing you to people like Dr. Jimmy or some of these therapists that we have connections with to help you as you are advancing your career, going towards college, whatever you're interested in. We want to make sure that we can help support you get there as well. Ben might have just put my favorite question on here. Which future treatment type are you most optimistic about?
Great question. I'm biased. I'm super biased. I I'm a physician scientist, and my goal is to basically design immunotherapies for children with cancer. Um, I think general big picture stuff, you could say to answer your question, Ben, 50,000 foot view, the future treatment type that I'm most optimistic about is immunotherapy. The future, um, when you want to look and think about what fields to sort of get into, you should probably think about where is pharmaceutical, where are pharmaceutical companies spending most of their money, and immunotherapy is by far and away that. So for the last probably 10 years, it's just overcome a lot of things, and people are really interested about it and high on it because you can be very specific in ways that chemotherapy can't. Chemotherapy, radiation, surgery, they just tack any cell that's in the area. Immunotherapy is very specific, and the goal is to try to create a differential between the healthy cells and the cancer cells. Now, if that's too broad immunotherapy, then the more specific point in immunotherapy would be bispecific cell engagers, BiTEs. But I'll put the big one that was kind of groundbreaking in pediatric. You can just look up that and Google that. Blinatumomab kind of recently has taken the world of leukemias and blood tumors by storm, and is leading to some great stuff. There's also CAR T cells, which are super, super cool. But I think the field's probably going to go more towards these things that blinatumomab is in the future.
Yeah. Honestly, the reason why I was so excited about this is anyone that's worked with me in the past knows that there's one treatment type that I am absolutely obsessed about. And you actually just touched on it. CAR T cell therapy to me is like the most ridiculous therapy process I have ever seen. I did have the pleasure of being able to speak with Dr. Carl June, the creator and founder of CAR T cell therapy. And I got to hear him speak about the potential future of it. And in my opinion, it's one of the most unbelievable. They're talking about CAR T cell banks to help those that maybe their T cells are a little bit too destroyed so they can go to more of a generic side. So literally the best way I can describe it is Star Trek technology. It's such I can't go into I could talk about this for hours, but it's such an unbelievable breakthrough that again with like Dr. Jimmy saying the last 10, 15 years, these immunotherapies have essentially revolutionized the cancer field.
Yeah. There's a really good documentary on Netflix about that. I forget the name of it, but with Dr. June in it, and the first patient who was treated with CAR T cells of a pen. It's phenomenal. Of medicine in men, medicine and miracles.
Correct me if I'm wrong, but they recently did test the first CAR T cell participant, and they did still find the rebuilt T cells in their system. And it was like
10
15
years
years.
out. She's now she was like 7 or 8 when she got her CAR T cells, and she's now a freshman at the University of Pennsylvania. So she's been at it for 10 years and no cancer, and her CAR T cells are still there. It's wild.
That's awesome.
And Ben asked, "Do you have a lab?"
I'm at the NIH. So one of the beautiful things about this fellowship here is the combined fellowship between Hopkins and the NIH, and so I actually work at the National Institute of Health in their pediatric oncology branch. My boss, in Bethesda, my boss, her name is Rosa Wynn. She's amazing. She's an immunotherapy person. But yeah, if you're interested in checking any of this out, just feel free. Like I said, I'll give my contact info to the crew at Ulman, and we can get in touch.
Great. I know we're running short of time. Any more last questions?
These have been great questions.
I did have one more, just to let you know. One last question. So earlier you did mention a medicine that has kind of jumped through as being something that does tend to appear to be working more. Could you talk a little bit more about that?
The blinatumomab?
Yes. Oh, was it that one, or was one earlier you were talking about?
Yeah. So absolutely. I don't really know. Said a lot of things. With
I think it was Blina.
A medicine that seems to be working. It was Blina? Okay, great.
I think so.
So I'm just for the last hour I've kept. Can you hear me?
Yeah.
You've been freezing a little bit, but I can hear you.
It's a little choppy, so I'm going to turn my screen off.
There you go.
Okay, I stopped my video, so hopefully that made just so that I can say this. Okay, so the last hour, I've kept it 50,000 foot view, but it sounds like Andrew, you've got at least a little bit of knowledge about what CAR T cells are. So, CAR T cells basically use an antibody, right, and fuse it to a T cell. And that kind of gets your functionality where you can basically bypass a very specific piece of the immune system and just go and target any tumor. Blinatumomab combines two antibodies. So it basically, if you ever had a friend, the way I like to think about it is, you have a friend at a party who like grabs you by one hand and grabs another person by another hand and like says, you two need to meet. Like you have to get in touch. You're going to have like a great relationship, right? It kind of brings both people together. Blinatumomab brings a cancer cell, the bad cell, and a good cell, the T cell, together right next to each other so that the T cell just kills the cancer cell. It's really cool because it can bypass the need to engineer the cells outside of the body. So you can give it to patients basically immediately if they need it.
That was really cool. Well,
It's a great
fantastic.
example.
Any other questions? This time is for you all.